Why does the United States spend more on healthcare than any other country in the world, yet millions of Americans still struggle to afford it? This isn't just a rhetorical question, it's a critical challenge facing our nation. In this video, we'll break down the real reasons why healthcare in the U.S. is so expensive and what it means for the future of medicine for patients, providers, and policymakers alike. The United States spends over $4.5 trillion a year on healthcare. To put that into perspective, this colossal sum represents nearly 20% of the entire U.S. economy. This means that roughly 1 out of every $5 generated in America is allocated to healthcare services, products, and administration. This figure stands in stark contrast to other developed nations. Countries such as Canada, Germany, the United Kingdom, and Australia typically allocate around 10 to 12% of their GDP to healthcare. This significant disparity begs a crucial question. What factors are driving this enormous gap, and are we truly getting value for our money? While our spending is unparalleled, our health outcomes, such as life expectancy and infant mortality rates, often lag behind those of many of these same nations. This paradox highlights a systemic inefficiency that demands our collective attention and understanding. One of the most significant, yet often overlooked, contributors to the U.S. healthcare system's exorbitant cost is its administrative complexity. The American healthcare system is not a single, unified entity. Instead, it's a fragmented landscape built upon a multi-payer model dominated by private insurance companies. Each of these insurers operates with its own unique billing systems, intricate paperwork requirements, and often opaque pricing models. Studies consistently reveal that up to 25% of all healthcare spending in the U.S. is consumed by administrative costs alone. This translates into hundreds of billions of dollars annually spent not on direct patient care, but on processing claims, managing prior authorizations, navigating complex coding systems, and resolving billing disputes. Healthcare professionals, from physicians to nurses, often find themselves dedicating valuable time to administrative tasks rather than focusing on clinical duties. This administrative burden creates inefficiencies, delays care, and ultimately drives up costs for everyone involved, from the individual patient to the largest hospital systems. The U.S. healthcare system is characterized by a complex tapestry of payers, including employer-sponsored private insurance, individual market plans, government programs like Medicare and Medicaid, and various other smaller entities. This multi-payer environment means that providers must negotiate different rates with hundreds of different insurers, each with their own rules, formularies, and reimbursement schedules. This lack of standardization leads to an enormous amount of overhead. For healthcare professionals and their staff, this translates into a constant battle with paperwork, appeals for denied claims, and the need for specialized billing and coding experts. For patients, it means navigating a confusing landscape of deductibles, co-pays, out-of-pocket maximums, and often unexpected surprise bills. This administrative overhead doesn't just add to the financial cost. It also contributes to provider burnout and patient frustration, diverting resources and attention away from the primary goal of delivering high-quality, accessible care. Beyond administration, the structure of our hospital system plays a pivotal role in driving up costs. Unlike many countries where hospitals are predominantly government-run or operate as nonprofit entities with strict regulatory oversight, a significant portion of U.S. hospitals function much like any other business. This means they are driven by the need to generate revenue and, in many cases, profit. This business model directly impacts pricing. When hospitals operate to maximize profit, they set prices that reflect not just the cost of care, but also their desired profit margins, investments in technology, and competitive positioning. This is why a medical procedure or diagnostic test, such as an MRI, that might cost $100 in a European country with a more regulated system, can easily exceed $1,000 or even several thousand in the United States. Furthermore, the trend of hospital consolidation has reduced competition in many markets, allowing larger hospital systems to exert greater pricing power. This lack of transparency and competitive pressure often leaves patients and even insurers with little leverage to negotiate lower prices. Another major driver of U.S. healthcare costs is the pharmaceutical industry. Prescription drug prices in the U.S. are notoriously high, often 2 to 3 times higher than in other developed nations. The primary reason for this disparity lies in a fundamental difference in regulatory approach. Unlike most other countries, the federal government in the United States does not negotiate drug prices for programs like Medicare. This absence of negotiation power allows pharmaceutical companies to largely set their own prices. While these companies argue that high prices are necessary to fund research and development for new, innovative drugs, critics point to the disproportionate spending on marketing and executive compensation. Patent protection grants pharmaceutical companies exclusive rights to sell a drug for a period, creating monopolies that further limit price competition. For patients, this means that life-saving medications can be prohibitively expensive, leading to difficult choices between treatment and other essential needs. For policymakers, the challenge is balancing innovation incentives with affordability and access. The United States is undeniably a global leader in medical innovation. Our healthcare system is often the first to adopt cutting-edge technologies, from advanced robotic surgery systems and sophisticated imaging techniques like PT scans and 3D mammography to AI-driven diagnostics and personalized medicine. These technological advancements are truly remarkable, offering new hope and improved outcomes for countless patients. However, this leadership and innovation comes at a massive price. The research, development, and implementation of these advanced tools are incredibly expensive. Hospitals and clinics invest heavily in acquiring and maintaining this state-of-the-art equipment, and they pass those costs directly to patients through higher service fees. While these technologies can save lives and improve the quality of life, their high cost contributes significantly to the overall expense of U.S. healthcare. The challenge lies in finding ways to make these life-changing innovations accessible and affordable without stifling future progress. Another subtle yet significant factor contributing to high costs is the practice of defensive medicine. In a highly litigious environment, healthcare providers often order additional tests, procedures, or consultations that may not be strictly necessary for diagnosis or treatment, but are performed primarily to protect themselves from potential malpractice lawsuits. This practice, while understandable from a provider's perspective, adds unnecessary costs to the system. These extra tests and procedures, even if they yield no new information, incur charges for equipment, staff time, and interpretation. While patient safety is paramount, the fear of litigation can lead to an overutilization of services, inflating healthcare expenditures without necessarily improving patient outcomes. Addressing tort reform and fostering a culture of trust between patients and providers could help mitigate this costly practice. Beyond the structural and economic factors, societal health trends also play a role in healthcare costs. The U.S. faces a significant burden of chronic diseases, such as heart disease, diabetes, obesity, and certain cancers. These conditions, often linked to lifestyle choices, diet, and lack of physical activity, require long-term management, frequent medical interventions, and expensive medications. Treating chronic diseases accounts for a substantial portion of healthcare spending. While individual responsibility is a factor, broader societal issues like food deserts, lack of access to healthy options, and sedentary lifestyles contribute to these health challenges. Investing in public health initiatives, preventative care, and health education could significantly reduce the incidence of these costly chronic conditions, thereby lowering overall healthcare expenditures in the long run. So, what does the future hold for U.S. healthcare? There's a growing consensus that the current trajectory is unsustainable. Experts believe that technological advancements, particularly in areas like artificial intelligence, AI, automation, and digital health startups, could offer pathways to lower costs and improve efficiency in the long run. Telemedicine, for instance, has seen rapid growth, demonstrating its potential to expand access to care and reduce the need for expensive in-person visits. New MedTech companies are constantly emerging, challenging established models and introducing innovative solutions. However, technological innovation alone won't solve the systemic issues. Until regulation catches up with the complexities of the market, and until fundamental reforms address administrative waste, drug pricing, and hospital transparency, Americans will likely continue to pay some of the highest healthcare bills in the world. The path forward requires a multifaceted approach, combining technological ingenuity with thoughtful policy changes and a renewed focus on value-based care. Now you understand the intricate web of factors that make healthcare in the United States so expensive. From administrative bloat and the profit motives of hospitals and pharmaceutical companies, to the high cost of innovation and the impact of chronic disease, the challenges are profound. What do you think is the biggest reason for these exorbitant costs? Is it the insurance system, the pricing strategies of hospitals, or the power of big pharma? Perhaps it's a combination of all these factors, or something else entirely. Let me know your thoughts in the comments below. Your perspective is invaluable as we collectively seek solutions. And if you found this explanation helpful and enlightening, please don't forget to subscribe for more in-depth analyses on healthcare, business, and AI explained, right here on MedTech Explained. Your engagement helps us raise awareness and foster informed discussions about these critical issues.